So it starts at 6.
Adams Memorial Hospital has been providing the full spectrum of physical therapy for decades. We have two of their physical therapists here, Sarah Vonnen and Sunny, to tell us more about the treatment approaches that you guys have. And I'm rolling up my sleeve already because I know we're going to talk about dry needling as well, right?
Yes.
But you have a number of different approaches, correct?
Yes, we do. And then we follow current concepts in orthopedic manual physical therapy and then aim towards the evidence-based practice. And then I'm certified in orthopedic manual physical therapy and then certification in dry needling and completed post-residency in clinical orthopedic manual physical therapy. And Sunny,
similar story, but not quite exactly the same, right?
Well, in Adams Memorial Hospital, we always strive to learn new things, so we always follow that evidence-based concept. So meaning we use current literature to try to make decisions on how to treat our patients better. So in that process, we attend continuing education courses, we take certifications. So some therapists might be skilled in one area, such as manual therapy. Some therapists might be skilled in other areas, such as neurological conditions. So we offer different services at the hospital.
Right, you've got enough people
Yeah.
there that you've got all the bases covered, really the full spectrum
Yeah.
of physical therapy and all the other therapies that go along with this. I guess I want you to start here because I want to know more about dry needling. Now this is a rather old technique that has kind of found favor again in physical therapy.
it is the newest technique which has been practiced in a few years and then which need a special treatment and special training. And this is dry needling is mainly aimed towards address the trigger points. So
Right.
trigger points sits on the muscle and then it's everywhere and then it's mainly in the deeper muscle. So we need to locate the muscle and
That's half the battle on my arm. Yeah.
So if it's once we locate the prominent trigger points, which is an active trigger points, we need to find the needle, and provided we follow all the adequate precautions, and then we need to put the guiding tube and then locate the trigger points and then free the needle and then put it in. And then once it sticks in, we need to penetrate a little deeper and to address the deep muscle. The one advantage of this needle is so we address the superficial muscle and the deep muscles. Like the muscles in the back, they have like a multiple layers. So the traditional approach is kind of a little hard, and then with the dry needling, we're able to go all the way deep in. The one good advantage is it's post-treatment soreness is nil, but the traditional approach, you have like a soreness after that. And another thing is few muscles are sits in a different positions, like a subscapularis. It's one of the rotator cuff muscle. It sits between the scapula and the chest wall. So to reach it is actually through the axilla, which is the armpit, where when we reach it, it's something hard to release the trigger points.
Yeah, right.
So with the trigger points, with the dry needling, we'll reach it from the spine and then put it in there and then release the trigger points, by which we're able to improve the muscle performance, increase the range and posture.
Okay, so because I noticed this, when you first did it, I don't really notice it now. I would be a candidate for this if I couldn't do what, or needed
pain
what kind of help?
Pain is the major complaint, and then there's like a movement limitations, and then we tend to treat with headache, TMJ joint pain, neck pain, shoulder pain, rotator cuff problem, and frozen shoulder. And we have a great success with frozen shoulder and headache.
That's
with this.
Pretty phenomenal. I like that. And again, how long then would this treatment last?
Usually we'll put it for 10 to 12 minutes, somewhere 15 minutes too, and then we stimulate every 5 to 8 minutes, and then we'll remove the needle, but the effects will stay 48 to 72 hours as per the research studies.
And the effects I'll notice right away? Or?
Yeah, it is right away,
Wow.
and patients, and most of them feel a little bit of like loosening and a little bit of like tension release.
That's pretty cool. Again, if you guys would be available, obviously, just by making an appointment over at Adams Memorial Hospital, dry needling is just one of the many advanced techniques that are going on there, as well as the soft tissue mobilization. You can find out more at adamshospital.org, 260-724-2145, and you see the extension there on the screen. We'll be right back on Insight.